So, when I say the word plague, what's the first thing that pops into your head? For pretty much all of us, it's gotta be the Black Death, right? This terrifying, unstoppable force that just tore through medieval Europe, leaving absolute devastation in its wake. It really feels like a disease that belongs in the history books, and only in the history books.
And look, that reputation is totally earned. During those massive pandemics, the plague didn't just kill people, it completely reshaped entire societies. You had this perfect storm of crowded cities, no real understanding of how diseases actually spread, and, of course, rats everywhere. It was the ideal breeding ground for a microscopic killer to just run rampant.
But here's the twist in the story. It doesn't actually end in the Middle Ages. The plague isn't some ghost from the past. The very same bacterium that caused the Black Death, it's still out there. It still infects people, and it's found in very specific parts of our world today.
Now, thankfully, we're not talking about massive, world-altering epidemics anymore, but we are talking about sporadic cases and small outbreaks that still pop up. Believe it or not, right here in the United States, more than 90% of cases show up in the rural Southwest. And if you look globally, most of the recent cases have been in Africa, especially in the Democratic Republic of Congo and Madagascar, with a few also happening in Peru. So the big question is, how does this ancient disease manage to stick around?
Okay, let's get into the nitty-gritty. To really understand how the plague survives, we have to put on our detective hats and follow the trail of this microscopic culprit on its pretty incredible journey.
So meet our prime suspect, Yersinia pestis. This is the little bacterium that's behind this whole thing. And you know, its primary home isn't actually in humans. It prefers to live in wild rodent populations. We're talking about animals like prairie dogs, squirrels, and rats. Think of them as its natural hideout.
So, how in the world does it get from, say, a prairie dog to a person? Well, it all comes down to a tiny middleman, the flea. A flea bites an infected rodent and sucks up the bacteria. Now, when that rodent eventually dies, the infected flea gets hungry and needs a new meal. It might hop onto your dog or cat, or it might just jump directly onto a human. And with that next bite, bam! It passes on Yersinia pestis.
And while flea bites are definitely the main highway for this infection, they aren't the only way. You can also get infected through a simple cut or a scrape on your skin if you happen to handle an infected animal directly. Which, of course, brings us to the next crucial question. Once the bacteria get inside the body, what happens next?
All right, so now we know how the bacteria sneak in. Let's take a look at what they do once they're there. See, the plague isn't just one single thing. It can show up in 3 very different forms, and it all depends on where the infection decides to set up shop in the body.
But before we get to the 3 types, we have to talk about the bubo. This is the classic telltale sign of the most common form of plague. It's a seriously swollen, incredibly painful lymph node, usually popping up near where the flea bit you. This one symptom is so famous, it literally gave the disease its most well-known name.
The infection doesn't ease in gently. It hits you like a truck. We're talking a sudden, violent onset of chills and a fever that can shoot up to a staggering 106 degrees Fahrenheit or 41 Celsius. It's the body's way of screaming that it is under a major attack.
This table here really lays it all out, the 3 different paths this infection can take. So first, you've got bubonic plague. That's the most common one. It starts with a flea bite and gives you those classic buboes. Then there's pneumonic plague, which is when the infection gets into the lungs, causing a really nasty cough. And finally, you have septicemic plague. This is when the bacteria just multiply like crazy in the bloodstream itself, which can cause limbs to turn black from gangrene. Yeah, that's where the name the Black Death came from.
Okay, this is absolutely the most critical point to understand. While bubonic plague comes from fleas, pneumonic plague is a whole different ballgame. It is the only form that can spread directly from person to person through airborne droplets when someone coughs or sneezes. And that, of course, makes it the most dangerous by far from a public health perspective.
I know, this all sounds incredibly grim, but the story of the plague in the 21st century isn't about doom and gloom. It's actually an amazing story about just how far modern medicine has come.
So let's put this in perspective. Without any kind of treatment, the historical death rate for bubonic plague hovered around 60%. And for the other 2 forms, the pneumonic and septicemic, it was almost always a death sentence. These are the stats that made the plague a legend.
But this one little fact changes the entire game. The discovery and, more importantly, the availability of antibiotics, it turned what was once a near-certain death sentence into a totally treatable illness. It changes everything.
Today, the playbook for fighting the plague is really clear and incredibly effective. It all starts with getting a diagnosis, fast, by analyzing samples. Speed is everything here. For the really severe forms like pneumonic, you have to start treatment within 24 hours. Then, we hit it with powerful antibiotics like streptomycin or doxycycline. And for those pneumonic cases, patients are isolated right away to snap that chain of transmission.
So we know it's still out there and we know we can treat it, but you know what they say, the best fight is the one you never have to have in the first place. So what are the simple, practical things you can do to prevent it?
Well, the advice is actually pretty straightforward. It's really all about creating some distance between you, rodents, and their fleas. Make your home less appealing to rodents. If you're out camping or hiking in those at-risk areas, use a good insect repellent, and definitely protect your pets with flea control. These simple things can make a huge difference and dramatically cut your risk.
And modern medicine has one more trick up its sleeve. If someone knows for sure that they've been exposed, like say they were in close contact with someone who had pneumonic plague, doctors can actually give them preventative antibiotics to stop the infection dead in its tracks before it can even get started. The story of the plague is just incredible. It shows us that with scientific knowledge and the right tools, we can tame even the most terrifying killers from history. It's a massive public health victory, no question. But it leaves us with a really critical question for our own time. We've learned how to fight the ancient diseases, but are we really ready for the new ones? The ones that have yet to show up?